Taking a step further to tackle the threat posed by the growing COVID-19 pandemic, Nagaland Chief Minister Neferio on Saturday launched the self-declaration COVID-19 Nagaland app in Kohima, making it compulsory for any person who had entered the state after March 6 to register in the app. The official app of the Health and Family Welfare Department will be crucial in tracking and surveillance of high-risk cases, thereby preventing spread of community transmission of coronavirus. Chief Minister Rio also in a public statement assuring the citizens that the government is taking all measures in regard to procuring medical safety gears, ventilators and other urgent necessities. He said that the first consignment of PPE goods have arrived, while the second consignment will be arriving on Monday with the aid of the Air Force. The state have received medical equipment consignment totaling 1,536, which includes triple-layer mask, PPE, BD Universal Viral Transport and swab sticks. Further additional medical equipment and accessories totaling to 2,16,800 is expected on Monday, Rio informed. Meanwhile, as a preventive measure to fight against the spread of the coronavirus, Kohima Municipal Council have begun the process of spraying disinfectants across the state capital. KMC administrator informed that 30 sanitary workers were swung into action to spray disinfectants across strategic locations in Kohima, targeting all public spaces such as traffic points, pathway, railings, bus stands and foot over bridges. Koimaize KMC administrators also informed that the process will be carried out on alternative days, however, noted that fund crunch, unavailability of resources and logistical problems continue to challenge the municipal council and its workers towards ensuring public safety. While Health and Family Welfare Principal Director Dr. Vizole Z. Sokre interacting with media person at the Directorate of Health and Family Welfare Kohima said 13 samples were sent for testing so far, out of which 8 samples were declared negative and the result of 4 samples are awaited.
We have sent 13 samples and out of which 8 samples are negative, and the last 5 samples we sent, we are still waiting for the result. Number of persons under home quarantine, we are tracking about 2,192.
Pointing out that there is no testing centers in the state due to lack of biosafety level laboratory both in government and private establishments. Sukre said samples were collected in all the district hospitals and sent in a special viral transport medium to the designated lab identified by Government of India. On the preparedness to prevent COVID-19, he said that the state has already identified in all the districts of symbol collections facilities, identifying of isolations and COVID hospitals at Kohima and Dimapur to ensure that hospitals don't spread to the general public.
We have declared COVID hospitals. We have already activated, right now we have 28 beds in Chedema, but that is up to 40 beds we can accommodate. Along with this Chedema for Kohima, we are also preparing for Naga Hospital to be declared as a COVID hospital, which is in the process. That is Dimapur District Hospital. We have 100 beds available for COVID patients. And we have ICU facility available for COVID positive patients.
He also urged the general public to maintain hygiene, social distancing and hand washing, which is one of the basic needs for the spread of epidemic.
Coronavirus is not airborne disease. So that's why we are emphasizing on social distancing. We are emphasizing on hand washing. So this, if we can practice these good practices, I think COVID, we don't need to fear about it. But don't rush to hospital unnecessarily. Crowding of the hospital also, I think it is not healthy in this particular epidemic.
Dr. Sukre, while asserting that the state is equipped with basic medical equipment, they are working on procuring ventilators and personal protective equipment for health workers. So far, no positive case have been reported in Nagaland. With Inzan Bemakhovong, Kohima.